the most rewarding mission I have done, even though all of them have been, it was probably Ebola, because you could see what a difference we could make, but also you could see how the human spirit and the willingness of especially the local communities to get through this crisis.
We've just heard from Dr Monica Arend-Trujillo, who did a fantastic talk about her work with MSF. So Monica, thank you very much for joining us today.
Thanks for inviting me. It was really an honor to be part of this conference and to speak to such an inspired group of students. A quick disclaimer to say that these are my own views and not necessarily those of MSF.
So, would you like to just give us a quick overview of your work?
So I work for MSF for a period of 10 years in different type of projects, some more permanent projects with long term, with hospitals in South Sudan, for example, where we had well-established programs, but also I work in some emergencies like in cholera epidemic in South Sudan, in measles epidemic in Zambia, and in the Ebola epidemic in Sierra Leone.
Could you briefly outline who MSF are and what their aims are?
So MSF is the abbreviation of Médecins Sans Frontières, is Doctors Without Borders. We are a humanitarian, independent medical organization that works over 65 countries around the world, and our aim is to basically get to provide care in places where there is natural disasters or epidemics or war or exclusion from healthcare. And our aim is always, when we go and work in a community, is to be able to empower that community to then continue caring for themselves when we leave.
So Monica, would you like to tell us about one of the more interesting projects that you've been working on, certainly with regard to child health?
Even though all my projects were not with exclusively for children, unfortunately they are often the more affected. So I think the more interesting ones were the epidemics. The most rewarding mission I have done, even though all of them have been, it was probably Ebola, because you could see what a difference we could make, but also you could see how the human spirit and the willingness of especially the local communities to get through this crisis was so inspiring to me.
So following on from that, what motivates you in your work?
Yes, so as I just said, the local community, it was one of my main motivations there in Sierra Leone, because these people were coming to work every day with a smile, with enthusiasm, to kind of care for their own people. And they were the ones who then were going home to their local community to be exposed to the infection, to see their relatives, their neighbors being infected, some of them dying, and they will still come to work every day like that. And in a project like that, when there was so many deaths, was to focus on the positives. The positives were the staff, but the positives were also the patients who were surviving. So every day, knowing that at least one patient will survive, it was amazing.
What advice would you give to someone who was thinking of doing similar work to your own?
Well, the main advice I give is that, keep that light ignited. So the way to do it, I think, is by, learning more about organizations doing this sort of work. I mean, SKIP is amazing because you're already, as students, starting that process so early.
Well, Monica, that was a fascinating talk from you just there, and also excellent to chat, so thank you very much.
Thanks for inviting me, and all the best.